Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all, get the most out of your Medicare benefits. Now, most are not aware of this, in fact, sometimes even shocked by this, but you realize that you will spend more money on medication costs than anything else in healthcare. Now, that may not be your present situation, but statistically, that is true. And therefore, if that's the case, we have to make sure that we're on the right drug plan. So choosing the right drug plan is critical for your Medicare coverage. Now, to make sure that you're on the right drug plan, you have to understand those plans and really understand how they're structured, because Medicare plans are structured differently than anything you've had before. They're different than individual plans, and they're different than group plans. And the reason for that is because Medicare plans have 4 stages. I'll explain what that means. So let's make a quick comparison between what you're accustomed to on individual plans and group plans, those that are covered at work. We would call those non-Medicare plans, meaning you're less than 65 years old, you're not on Medicare yet. So non-Medicare plans actually have 2 stages, which means your out-of-pocket cost can vary 2 times. You sometimes have to reach a deductible. Once you've met the deductible, then we move over to the second stage, which is copays. And these are very reasonable cost copays. And once you're here, then your copays will be fixed all year. So from January to December, you may never see your copay change throughout the year. You've met a deductible if you have it. If you don't, that's waived. We pay copays, which never changes. And that's typical of individual and group work plans. Now, Medicare actually has 4 stages, and this is what makes them confusing. Most plans start off with the deductible. Some waive it, but most have it. Once we've satisfied the deductible, then we go to copays. Once we're done here, now our copays can actually change 2 more times. So our copays can change during the year a total of 4 different times. And so I'm going to explain the different stages of Medicare plans. Now, stage number 1 is the deductible stage. Now, Medicare sets the deductible every year. It usually goes up a little bit. This year, it's $435. Last year, it was $415. So they raised up a little bit, and they typically will continue to do that. But in this particular stage here, what you're paying is the retail cost or just the tier cost of the medication. It varies from plan to plan. But let's just say you're taking 2 medications. Let's say you're taking something for your cholesterol, very common today, called atorvastatin. It's generic Lipitor. That typically is a tier 1 medication at a $2 copay. And let's say you're taking something for your thyroid. Most people that are taking a brand name are taking Synthroid. Others that are taking generic are taking levothyroxine. Very common medication. Again, typically a tier 1, very low cost med, $2 copay. So let's say that we're in this stage here, and we go to the pharmacy and pick up our prescriptions, and they're $2 a month. What are we spending every month for our meds? $4. And $4 times 12 is $48. And if that's all I spend on my meds for that year, $48, will I ever reach my deductible? And the answer is no. And if you never reach your deductible, you will stay in this stage the whole year. And by the way, that's probably 80% of you. You're not on a lot of meds, or the meds you're taking are very low-cost meds, and so you'll stay in stage 1 the entire year. Now, some of you, though, however, you're going to meet your deductible, and you may meet that deductible very quickly. Let's give an example of someone that's taking Eliquis or maybe a Xarelto, some expensive medication that retails for $500 a month. Well, absolutely, you're going to meet your deductible the very first time you pick that medication up. So that deductible would be satisfied if that retail cost is at $435 or above. So once we reach the $435, now we are done in this stage. If we ever get there, again, only about 20% are going to move on. But if we reach the number, then we go to stage 2. We call that the copay stage. Now, it is here where you're very accustomed to drug pricing, because it will always be based upon the tier of the medication. Every medication covered by the plan will be given a tier number. And with that tier number, that establishes what your copay is going to be. So let's go back to my Eliquis or Xarelto example. It's always a tier 3 preferred brand medication. By the way, these tier 1 and tier 2 are typically, not always, typically generic, and these are going to typically be your brand name medications. So that Xarelto or Eliquis is going to come in somewhere about a $50 copay. So you're paying about 10% of the actual retail cost. And so every time you get a prescription filled in this stage, why are we here? Because we met our deductible. Now we're here, and we're simply paying copays. Now here's where things change. Every time you get a prescription filled in this stage, every time, Medicare behind the scenes is tracking the retail cost. The retail cost. You're not paying retail. but you are paying a copay, and the difference between what you're paying and the retail cost, the insurance plan that you chose is covering the difference. Medicare tracks retail, what you're paying, what the plan's paying, so that total retail cost, if it ever reaches a certain number, called the threshold. And that threshold number changes every year. This year it is $4,020. Now may I remind you, you did not pay that. This is your copays based upon tiering, and the balance is paid by the insurance company, but this is the total retail cost. Now, just so you know, 95% of all people on Medicare plans will not reach the threshold. Only 5% of people will reach that. Now listen, I have two ladies right now that are on $7,000 a month medication. They reach that in 3 weeks. If you're an insulin-dependent diabetic, you're taking Novolog, Humalog, Lantus, some of those quick pen type of insulins, you're going to reach that in somewhere probably between, on average, 2 to 4 months. And again, 95% of you will never reach it. But if you're on expensive medications or maybe lots of medications, you may eventually reach that. But whenever you do, if you ever do, now we're done in this stage because we've reached the threshold. So that takes us to stage number 3. Now in this stage, this is called the donut hole. Medicare calls it the coverage gap. But here we have a different copay cost, and that copay cost to us is going to be based upon the retail cost of the medication. So again, if I'm on that Eliquis or Xarelto at $500 retail a month, I'm going to pay 25% of that. So what's 25% of $500? $125. So now my out-of-pocket cost is $125 for any medication that I'm taking while in the donut hole. Now, what's happening, again, they're tracking the cost of medication, and so if that next number ever gets to $6,350, and by the way, it has nothing to do with this number. This is a brand new number. And just so you know, only 1% of the Medicare population will ever see that particular number. Yeah, most people that get in the donut hole just stay here paying 25% of the retail cost. But if we ever reach $6,350, then we're done in this particular stage and we move to the final stage, which is called catastrophic coverage. Now, by the way, anyone who gets here is very happy because medications are very inexpensive. And so now your copay is 5% of the actual retail cost of medication. So what's happening? 5% of that $500 would be $25. And so you can see now that that medication has changed 4 times. We had to meet a deductible. We had to pay our tiering price. If the threshold was reached, $4,020 retail costs, that moves us in the donut hole. Now we're paying $125 copay, 25% of all other medications, and if we ever reach $6,350, then we're moving on to catastrophic, where now we pay a very low cost, $25 for that same medication. It changed 4 times. Now, this is where you're going to stay until the end of the year, because what's going to happen is once we hit December 31, we get to January 1, we start all over and we work our way through these stages. So as you can see, prescription drug plans are structured differently than anything you've had before. And it's critical that you are on the right drug plan. If we can help you further, go to MedicareSchool.com and we can teach you more about this, but it's important that you have the right drug plan. Thanks so much for watching. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.